Facelift is a highly effective method to rejuvenate the face. It involves assessment in clinic, usually over 2 to 3 appointments, where we'll establish the aims of the patient and also examine them in detail. From there, we'll select a range of procedures to treat the patient from a number of options. For example, a mini versus a full face neck lift, together with any allied procedures such as eyelid surgery, brow lift or fat grafting to the face. Younger patients with better necks may often be suitable for a mini facelift alone. More older patients, particularly their neck is lax, are probably best suited to a full face neck lift. And we'll also discuss with the patient any additional procedures that may be of benefit to them. Surgery for the actual facelift, incisions are made on the front of the ear alone if it's a mini facelift. If it's a full face neck lift, the incision will extend around the back of the ear and into the hairline adjacent. Skin envelope is then raised, and the deeper tissues, which are called the SMAS tissues in the face, are resuspended and recontoured to produce the new rejuvenated shape. This usually results in a fuller cheek, a slimmer lower face, sharper neckline and sharper jawline. The surgery takes place over a number of hours and normally requires a night in hospital. Drains are placed together with a head bandage, which are removed the following day before the patient goes home, and then return for stitches at about a week post-op. They'll normally need about 2 to 3 weeks downtime to recover from the procedure. Rhinoplasty is a procedure to produce a more idealised version of a patient's nose and fit optimally with the rest of their face. Usually we'll see the patient for assessment at least a couple of times in clinic to establish their aims and to take a number of detailed measurements. From there we'll recommend a treatment plan for the patient. And at surgery there's a number of different options, usually between an open and a closed rhinoplasty. Closed rhinoplasty involves incisions just on the inside of the nostrils. An open one involves a small incision between the nostrils also. From there we will normally elevate the skin envelope, refine the tip, and then address the bridge. This often may involve removing a hump or straightening the dorsal profile. We'll also often narrow the bridge and commonly reduce the whole size of the nose and perhaps shorten it. This may also involve adding some cartilage grafts to produce support or adjust the shape in certain areas. Other patients, if the nose is deviated, we may need to straighten the nose, or if they have an ethnic nose, we may need to augment the dorsum to increase the profile. After surgery, the patient normally has a pack overnight. They normally have a plaster on for about 10 days. They'll come back to clinic for the plaster to be removed, and then we'll tape the nose, usually for another 3 or 4 days afterwards. So the patient normally needs about 2 weeks downtime from their work and social activities, and normally have a pretty good view of the new shape of the nose by 2 to 4 weeks. But the final results can take longer, certainly up to about 9 months to see the final shape, particularly around the tip as the swelling settles. Regarding facelift and rhinoplasty surgery, there's not necessarily a strict order into which one should be done first. It really depends on the patient's priorities. If a patient's got a very strong nose that's causing them a lot of distress, as opposed to facial laxity, then they'll tend to prioritise the nose first. If aging is much more significantly a problem rather than nose shape, then they'll usually look to address that at the first stage. There may be some discussion amongst surgeons as to whether the order affects the redraping of the skin around the face and the nose, but I don't feel this is a significant issue. It is possible to have a facelift and a rhinoplasty together, but it depends on the length and complexity of each procedure. For example, in a relatively younger patient with a more straightforward rhinoplasty who is perhaps having a mini facelift, it may well be possible to combine the procedures, as the length of the procedure is not likely to be too long. However, in an older patient who may well be having more extensive facelift surgery, such as a full face neck lift, perhaps together with further neck surgery, brow lifting, eyelid surgery or fat grafting, this procedure can be quite a lot longer. Combining it with a rhinoplasty in addition is likely to lead to very long anaesthetic times. It's probably not best combined in this manner. So yeah, I think for the older patient, it's probably better to separate the procedures. Patients looking to undergo cosmetic surgery should have a clear view of the aims and the results they'd like to achieve from the treatment, perhaps to have researched it online or from other sources, and optimally they would take an opinion from more than one surgeon to get a range of views. Best to see a surgeon who's specialised in cosmetic surgery and is on the GMC specialist register for plastic surgery. It's also worth checking if they're a member of a professional body around cosmetic surgery such as BARPS or BAPRAS. When they go to their consultation, they should make sure they're seeing the surgeon who's actually going to do the procedure rather than a salesperson or nurse or other person. They should allow plenty of time to discuss the procedure with the patient and to examine them in detail. Patients should also look to see examples, photos of their work, and perhaps speak to one of their previous patients.